These days, even healthcare providers often have never seen a case of measles, so they're late to figure out what's going on when somebody comes into hospital with a rash. They don't think about measles. They think, oh, we don't have measles anymore. Children can die from measles in Canada in the same way they're dying from measles in Europe right now. So we really can't afford to be complacent. It's incredibly infectious, one of the most infectious diseases we know. And because it spreads so easily, you don't have to leave Canada, or you don't have to leave North America. It can be passed in the air in a room where somebody's actually left the room who had measles. There's actually no treatment for measles at all. There's no treatment for rubella, for German measles. There's nothing we can do. If your child gets measles, we can't do anything for your child. So really the only thing you can do is get vaccinated, or get your children vaccinated, and persuade other people to get their kids vaccinated too, because that's the best way for everyone to be protected, is if everyone is vaccinated. Vaccine hesitancy is one of those things that we're struggling with at the moment. I think one of the best ways of thinking about how vaccines are important is the fact that we can be hesitant about them is a direct result of how well they work. That sounds a bit kind of paradoxical, but the fact that these vaccines work so well at preventing diseases, so they've disappeared, means that parents can forget why they're vaccinating their kids. Parents have no idea really what measles looks like anymore, and so they don't get their kids vaccinated. If you go back to our grandparents' time and when polio vaccines first came in, parents were lining up around the block to get their kids protected because they knew what was at stake. They understood the risks. We don't take anything for granted, and if somebody presents good evidence to me that there's any kind of safety problem with a vaccine, I'm going to be the first person to say, let's stop the program. The fact is, the reason people like me keep on saying we must carry on vaccinating is because we've actually moved beyond the science, because the scientific questions aren't there anymore. We're in a world of facts where we know the vaccines are safe and we know they work. If a parent looks at the internet, they're going to find a whole load of incredibly scary stuff. You need to think about who is saying those things. So if you want to get good information, there's a website called Immunize Canada. There's the Public Health Agency of Canada. My own organisation has information that's recognised by the World Health Organization to be reliable on vaccine safety. The Centers for Disease Control and Prevention in the US and the World Health Organization have good information. I also think if you want to know more, go and see your own doctor, because your own physician really has your best interests and your child's best interest at heart. People talk a lot about choice when it comes to vaccines, and I do strongly believe that getting yourself or your kids vaccinated is a choice, but it's not a choice you make on your own. What you choose to do affects everybody else. And there are people who can't choose because they're either too young to get vaccinated, people who've got leukemia, other cancers, anything that affects your immune system. You don't have a choice. And if you've ever spoken to a parent whose child has got any kind of health problem and who can't be vaccinated, they live in fear of somebody else giving their child an infectious disease, because that is the thing that is most likely to kill them. It's a terrifying place to be, and they have no choice.